On this week's episode of Caribbean Diaries.
From the onset, we had to institute some real stringent measures to have our people comply with the protocols that we were putting in place. As you know, us Caribbean people, we love our freedom. We love to be able to go to the beach and do all these things on a regular basis. So It was no easy task, getting our people to settle down, to understand that, this is serious. And it has to do with all of us, and we will need everybody's cooperation in order for us to get out of it. We also had to request assistance from Cuba, our sister island, Cuba, where we received in excess of 100 doctors and nurses who came to our aid very early. And as a result of that, we were able to continue to contain the virus here in St. Lucia as best as possible.
Welcome to Caribbean Diaries.
St. Lucia ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique kon bol en main base ti boutique changer distance sociale 6 pieds Rodyon à l'autre. I ka travail tan, si ou senti ko pa cordial, quarantine ko, pas en contact et puis l'autre, en cas où te toi pe exposé. C'est un écouye, free 11 ou ben n'importe clinique yo pou. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. St. Lucia be a soldier. Together we can beat this corona.
While many of our Caribbean nations have been overwhelmed with the fight against this pandemic, St. Lucians are optimistic that they will come out victorious. So joining us now is their Minister of Health, Senator Mary Isaac. Hi, Senator. Welcome to Caribbean Diaries.
Hello, good day. How are you?
I am good, thank you, and thank you for joining us.
Thank you for inviting me on.
I want to start, first of all, with getting a picture of how things have been for St. Lucia through this COVID-19 pandemic.
Yes, it has been quite hectic, I must say, because as you know, COVID is very dynamic. So we have had to always be on top of the situation and be very proactive about, managing the pandemic.
Yes.
So from the onset, we had to institute some real stringent measures to have our people comply with the protocols that we were putting in place. As you know, us Caribbean people, we love our freedom. We love to be able to go to the beach and do all these things on a regular basis. So It was no easy task, getting our people to settle down, to understand that, this is serious. And it has to do with all of us, and we will need everybody's cooperation in order for us to get out of it.
Senator, I'm not sure if you're able to share with us some data on how COVID-19 has progressed in St. Lucia, the number of cases, and on average, how that's played out over the past couple of months?
Well, we had a period where we were almost at the point where we were able to contain the virus, and then we had a spike. But generally, we have about 200. We were having about 200 cases, or a little over that per day recently. In the beginning, we started out very slowly, and we did not have a first case until the March the 13th in St. Lucia. Then we started putting things in place, looking at the different curfews that we had to institute, and so on. But to date, we have had about 3,800 cases, confirmed cases. We have had about 40 deaths so far, COVID-related deaths, we say, in St. Lucia, because we we are not able to say that they are only caused as a result of COVID alone. Most of the people have had underlying conditions. And we have tested about 33,000. We've done about 33,000 tests to date.
I'm curious about your testing protocol, Minister. Do you have independent labs who test in St. Lucia, or are all persons tested through the Ministry of Health's system?
We had a system where all persons were being tested through our public facility, our public health lab. But we opened it up when we had the spike. We had to open up so that some of the other hospital or private hospital could have carried out the rapid test. And some other medical practitioners and other labs are now carrying out the rapid test. But we reinforce it with the test from the public lab, the CPR test from the public lab, when there is a need to do so.
Globally, unexpected, and so in terms of the number of personnel that the globe has been able to roll out to respond to the pandemic has been challenging. It certainly has been here for us in Jamaica. We've had to pull on student nurses and student doctors to support. What's been the case in St. Lucia?
Well, we are very small, and we had to pull on all our healthcare personnel. So all nurses, assistant nurses, anyone in the healthcare field that was not employed has become employed to date. We also had to request assistance from Cuba, our sister island, Cuba, where we received in excess of 100 doctors and nurses who came to our aid very early. And as a result of that, we were able to continue to contain the virus here in St. Lucia as best as possible. Mm-hmm. We've had about 2 spikes during activities such as Christmas. We have had spikes, but we've been able to bring those spikes back under control to date, and we are looking forward to continuing to doing so.
Yes. You mentioned that you also had to retrofit
yes.
a hospital space?
We had a hospital that, of course, we had moved out of into a new hospital. Mm-hmm. And that hospital was earmarked for other things, but we had to retrofit the old hospital, Victoria Hospital, so that we could accommodate our people coming in, our confirmed cases of COVID. We also had to co-op some hotels for us to house our quarantine cases that we had to quarantine, persons coming in, nationals from the diaspora and so on. We have had to co-op with assistance from a few hotels for us to house these persons. We are still occupying some hotels on island to do so. And at some point, we actually had to use some of these facilities for isolation as well, because our hospitals became overwhelmed. Mm-hmm. And we needed assistance from other agencies and to identify facilities to house some of our isolated cases. But now this is, we have brought that back under control, and all our isolated cases have been isolated at the retrofitted facility. But our quarantine, we still continue to use the hotels for quarantine purposes.
What are your reporting measures? I suspect that's one of the ways in which you manage the pandemic, and you've said that you managed to get it back under control. If someone is tested positive, if they're asked to isolate or quarantine, how do you monitor those individuals?
We have a contact tracing team that was put in place from the onset, and they do all the contact tracing as well as the monitoring through the Ministry of Health. Okay. We have employed quite a few persons to assist in that endeavor, and this is how we monitor. We have a team going out to do the monitoring. We have a team going out to identify homes where people can do home quarantine, so they come back and report and ensure that the facility is adequately furnished and adequately located, so that we can carry out home quarantine. We also have instituted an electronic device where we put a bracelet on people so that we can monitor them. Their temperature is monitored, I think, twice a day. And those bracelets can also allow us to know where the person is at any point in time during the day.
Wow, wow. In terms of visitor arrivals, tourism, cuts right across the region. And for you, how has this been affected by COVID-19? And is St. Lucia opening up its ports to visitors?
Well, we have an economy that depends on tourism. And therefore, one of our concerns was that we had to ensure that we kept our border open for as much as possible, because there was a time when we had a curfew and we had closed our borders altogether for about 7 days. But when we look at our economy and how we sustain our people, we had to ensure that we reopen our borders as quickly as possible so that we could allow the tourism sector to continue, though at a very minimum. But we still were able to allow some of the hotels, main hotels, to continue to operate. Mm-hmm. We had a different system for our tourists coming in, because they were coming in into quarantine on the facility. So all tourists were channeled directly to wherever they were going. They come in with their COVID negative test, and they would stay on the premises of whatever hotel they went into, and for the entire stay until they had to go back. There were a few activities organized just for these tourists, especially a few land and sea tours, and we had very strict protocols in place at these different locations, because they were our local people were informed that it is just for the tourists. So we were able to manage that quite well, and with the cooperation of our people, our citizens, that has been going on very well. Now we have additional hotels that are opening, and we will continue to open our hotels, because we really need our economy to reopen so our people can go back to work, so that they can sustain their own selves and their families.
The COVID-19 pandemic has changed the world on several fronts. The way we interact, socialize, conduct business, trade, and make money may never look or feel the same until the all clear is given. St. Lucia was not spared the grappling effects of the lethal virus, as we saw vital sectors grind to a complete halt, leaving thousands unsure of what the next step may be. The government of St. Lucia has implemented the Social Stabilization Program to help cushion the economic and social shock and provide some level of relief. So let's take some time to break it down. Have you lost your job or lost the opportunity to generate an income as a small business owner due to the COVID-19 pandemic? Well, temporary income support will be provided to NIC contributors as well as non-NIC contributors for a period of 3 months in the first instance. Those who have lost their jobs because of the pandemic will receive an allowance, $500 to $1,500 monthly from April to June 2020. Non-NIC contributors will not be left behind. Small business persons, taxi drivers, vendors, those who have been displaced through the loss of income will receive $500 monthly for 3 months. For more information about this subsistence allowance, head over to NIC's website at www.stlucianic.org or give them a call at 452-2808 or 454-6758. Take some time to go through the guidelines. You or someone you know may be eligible for this support. The objective of the Social Stabilization Program is to ensure that persons have access to basic needs, buy food items, medication, and other essential supplies to help weather this ongoing health crisis. Bus drivers, farmers, local manufacturers, you too will receive several incentives and different forms of support to ensure that you keep operating and, where applicable, help boost production, local enterprise, and manufacturing. Minibus drivers will receive financial relief through the payment of $1.1 million in a fuel rebate. Farmers and fisherfolk, support will be given as the government injected $1 million into the National Farmers Trading Organization. Plus, several concessions are being discussed to help boost the production of sanitation and healthcare products locally. A Buy Local campaign will be the main driver to help jumpstart our economy, reduce our food import bill, facilitate diversification, encourage investment, and creative enterprise. More information about all of the incentives will roll out in short order, as it's only the beginning, and the government of St. Lucia is committed to ensuring that our country emerges stronger and financially fitter. To achieve that, we must work together in these uncertain and difficult times. Now is the time. Let's do this together.
The vaccine is in St. Lucia.
Yes.
What is your vaccine rollout plan?
Our vaccine rollout plan is to vaccinate the frontline workers first, and then we roll it out to the senior citizens, persons with underlying medical conditions, especially our seniors. And then we have other people who work in care facilities, and it goes down to, you know, ordinary people in society, teachers, you know, and so on and so forth. So it has been rolling out very, very well.
Mm-hmm.
We have had 23,000 vaccines sent to us so far. We got 2,000 from Dominica, 1,000 from Barbados, and you know, we are very grateful for governments in these countries who came to our aid. These were the first sets of vaccines that we received.
Mm-hmm.
And of course, we received another 25,000, of which we shared 5,000 with a sister country. And so far we have 23,000 vaccines, and the rollout is going on exceptionally well. We have so far vaccinated over 10,000 persons with these vaccines, and every day we have crowds and crowds coming to get vaccinated. So it's really been well received, and we are looking forward to getting our additional batches of vaccine through the COVAX mechanism in about 2 weeks' time, because we do not want a situation where we have people coming forward and we run out of vaccines. So it is really, really going well. It's going a lot better than I thought it would. There are a few people who are, you know, who have questions and queries. They are, you know, skeptical about taking the vaccine. But at this point, we are seeing very, very few people who still have issues, who have concerns about taking the vaccine. Most people expressing the view that they ought to take it, and they are willing to take it at this point.
Yeah, you're rolling out under the theme vaccinate for you, for yours, for us.
Yes, that's right.
Yes.
So it is for everybody. It is a community effort, because, you know, we are seeing the literature coming out and indicating that people who are vaccinated may be able to interact without wearing masks and so on. This is the literature that is just starting to come out. So we are very hopeful that everybody will agree to take the vaccine so that we can all, you know, communicate and we can start seeing the mask going down.
Yeah. By your estimation, what percentage of the population do you think should be able to receive the vaccine by the end of the year? What are your projections for your rollout plan?
As long as we continue to get our vaccines to you know, what it is that we have purchased and so on, and what is supposed to come through PAHO, the COVAX mechanism and so on, I believe that everybody who wants to be vaccinated will be vaccinated by the end of the year. Because at this point, within a 7-day period, you are seeing where we have vaccinated over 10,000 people. So that is quite an effort, and you know, the people are cooperating. So there is no reason why the entire country will not be able to be vaccinated by the end of this year.
Senator, as Minister of Health, what are your hopes for the region coming out of COVID-19?
Well, I'm hoping that the people in the region will step forward, take the vaccine. And while they're doing so, until we get the all clear, they will continue to follow the protocols, especially wearing your mask, distancing, washing your hands, sanitizing, and so on. We have come a long way, I believe, in this fight. And I can see a silver lining at the end of, you know, the road. And therefore, I don't want people to drop their guard just because we are saying people are coming forward and getting vaccinated. And I think the region, people should consider the fact that you do not know whether the person next to you has taken the vaccine, and therefore you still have to try and protect yourself until the figures come out to indicate that the majority of people in the region, in our different countries, have taken the vaccine. So for the region, I hope we do not let our guard down. We do what is necessary. We continue the fight the way that we have been doing, so that at the end of the day, we can all breathe freely. We can all exhale freely. And, our region will go back to where we left off and continue to progress and, continue to boom the way it was booming. I believe our region was well on its way to showing great success in terms of job creation, in terms of employment, and in terms of our people, reaching their highest heights. And this is where we want to get back to, so that we can continue along our journey in terms of economic sustainability.
All right. Thank you so much, Senator. I know your plate is full, and we're grateful that you spent some time talking to us here in Caribbean Diaries. All the best to the people in St. Lucia.
Well, all the best to all our people in the region. I hope everybody gets their vaccine, and then, so that we can get back to where we left off.
Thank you so much for speaking with us. Senator Mary Isaac, Minister of Health and Wellness in St. Lucia.
On our next episode,
there is just this lack of an ecosystem. So we're putting startups, we have actually launched applications now for startups in the region to get involved, to participate in an 8-week course where they'll be learning from some of the best minds in the world. They'll be getting access to up to $600,000 in resources from some of our partner companies. Those include companies like HubSpot, in some instances, Google, Facebook, Stripe is one of them, Shopify, which is the world's largest e-commerce, I would say, support system, really, or engine, amongst others. And it's a wonderful opportunity for startups, and we're very excited.
Lucia, that's another episode of Caribbean Diaries. See you next time.